Ballad Health representatives once again will make their case for consolidating Level 1 trauma care at the Johnson City Medical Center and downgrading services at Holston Valley Medical Center. But this time, citizens opposed to Ballad's changes have been granted an extended period of time to speak at that public meeting in Wise County, in part about some of the concerns of Southwest Virginia EMS providers. A Wise County Board of Supervisors meeting is underway as we speak. Ahead of that meeting, News Channel 11's Jackie DeFusco spent a few hours with one of those first responders to get a sense of the challenges they face, challenges that are driving their concerns.
Well, Josh, Ballad Health has already began what they promised would be about a 10-month implementation process where they say they'll collaborate extensively with EMS to address some of those concerns and develop protocols for a coordinated regional system. But currently, some EMS providers are concerned Ballad leaders do not understand the reality and requirements that first responders face in the field.
Things out here are a lot different. You never know what you're going to come around a curve and see.
Meet Chris Hill.
Another common problem.
Self-described as 5'0"
Ah!
and just over 120 pounds.
I love my job.
But she's one of many Southwest Virginia EMS providers on the front lines, providing care to a region
Now I can get through, I think.
strapped for resources.
You know, we've always made things work in a pinch. We'll do what we got to do to get to our patient.
She shows us a home down Winding Way.
I know this is just one house. It's not a community, but there are so many places like this. I don't have time to show you.
She says you can't land a helicopter here, and it's nearly an hour drive from Holston Valley Medical Center in Kingsport. Hill says that's why EMS providers are worried about added transport time to Level 1 trauma care, soon to be only in Johnson City.
Many of these EMS agencies are working at capacity or near capacity every day. And when they are not available, it may mean that other emergency calls in their territory may have a delayed response.
Ballad Health says only 10% of cases, what they call major traumas, will be diverted to Johnson City. But some EMS providers insist it'll be more than that due to state-mandated guidelines first responders are required to follow.
The number of patients identified by EMS per their field criteria will be greater than the number of Level 1 patients determined after arrival to a hospital. It's purposely designed to be that way so that any patient that may potentially require Level 1 trauma services will be taken to a Level 1 hospital.
Ballad acknowledged this disparity in a recent public meeting.
Might there be some disparity above that? There might. How much that's going to be, we don't exactly know, but that's why we need to collaborate with EMS to figure out what the best protocols are.
To make sure that longer distance does not result in lives lost.
We care about our people. I mean, this is our families, you know, our friends, our children.
Now, important to reiterate, that 10% number Ballad has cited as being major traumas, it's based off a trauma score given after the patient is admitted to the hospital. Now, EMS providers use a different scale based on, for example, vital signs of patients they see in the field. These first responders I spoke to say Ballad should have considered this disparity in their initial analysis before making their decision. Now, their hope is that Ballad will sincerely listen to those who best understand conditions on the ground.